Today, we're talking about stress in teens with autism. People with autism often struggle to manage stress, and prolonged stress can lead to depression, anxiety, and feelings of social isolation. Understanding common stressors for people with autism is an important step in learning the signs of stress responses and effective coping strategies. Teens and young adults with autism may experience stress differently than someone without autism. Stress may be felt more intensely, may happen more frequently, or may last for longer periods of time. The reason that adults with autism may experience stress so differently has to do with the behavioral traits associated with autism, as well as the social isolation that a person feels when they struggle to, quote, conform with society. Understanding stress in people with autism is a foundation for developing effective coping strategies, and developing effective coping strategies will help to reduce anxiety, depression, and isolation for a healthy transition to adulthood. So, what can happen if your teen never learns to manage stress? Research shows that people with autism who have typically developed cognitive abilities have higher rates of mental health issues. This is because they're aware that they are, quote, different from their peers, and this awareness causes depression and anxiety. If left untreated, depression and anxiety will take the joy out of life. If your teen has a developmental delay or delays in cognition, he or she will feel unheard or unseen. And having ineffective stress management skills may cause them to not be understood by others. Your teen will be unable to communicate needs, robbing them of social interactions and the independence that they crave. So, whether you are a parent of a teen with autism or you're an adult with autism interested in learning about stress management, this video is for you. But before we get started, I want to tell you a little bit about us. We are Autism Services for Teens and Young Adults. We are a team of licensed occupational therapists who are trained in brain development and experienced in helping people on the spectrum transition to adulthood. We approach stress management for adults with autism uniquely and comprehensively by teaching new skills, setting up the environment to reduce stress, educating about the underlying causes of stress, and finding new ways of approaching old tasks. Stress management for teens and young adults on the spectrum will not happen with only behavioral modification or behavioral changes. We understand that education, finding the right support, and learning new habits will help change the way the brain responds to stress. Effective stress management will take time, patience, a little curiosity, and some consistency. And while we are not offering medical or legal advice in this video, we hope to provide you with the right resources to start your journey towards effective stress management. And if you continue to struggle or would like more support, we encourage you to find an occupational therapist who can help you and your teen with short and long term strategies to manage stress and transition to adulthood. Now, let's get started. Teens and young adults with autism are all different. There is no one stereotype that can be applied to someone on the spectrum. However, certain behavioral traits may be observed in people with autism. Those traits are repetitive behaviors and mannerisms, difficulty sleeping, sensitivity to touch and textures, extreme emotional responses, difficulty managing emotions, and difficulty interpreting other people's nonverbal and verbal cues. Most people may experience many of these traits on a given day, especially during extremely stressful times. So, stress makes behaviors more extreme, and the characteristics I just described can become more noticeable during stress as the person tries to cope with the stress. Common stressors for teens or adults on the spectrum are dealing with new situations or life changes, meeting new people, making friends, developing relationships, feeling different than other people, or feeling isolated or an outcast because of the autism diagnosis, facing demands such as school, deadlines, work demands, not being able to communicate your needs or your desires. As we've mentioned many times in other videos, there are no brain changes associated with autism. If you compare the brain of someone with an autism diagnosis to someone who does not have the diagnosis, there's no structural difference. I say this to ensure you that stress management can be taught. Learning why stress happens and how to effectively manage it, along with patience, consistency, and repetitious practice, will change the way the brain functions. In time, you'll recognize the signs of stress, understand why you respond to stress in certain ways, proactively apply effective techniques for managing stress, and begin to enjoy life more fully. One way to understand your stress response or your child's stress response is to recognize the signs of stress. Each person's stress response is different and personal to how that person has learned to cope with stress in the past. When coping with stress, do you shut down and pull within yourself, turn your face away and stop talking? Well, this response protects you from the overwhelming feelings you are having in the moment. You're like a turtle pulling yourself in for protection. To learn a new long term coping skill for managing stress is to identify what makes you shut down. Do you shut down when faced with demands, confusing communication, or social interactions that are too intense? If your child is nonverbal, identify what happened before the stress response. If you can journal, write these observations down to start reflecting on the current stress response and why it's happening. When coping with stress, do you react emotionally to a stressful situation and respond with anger, crying, or other behaviors showing strong emotions? If so, you probably feel relief after you have released the anger, but also shame if other people reject you because of that response. In this situation, write down the signs of a strong emotional response. Did you respond this way immediately? Or were you tired or hungry or in pain? What changed in your life or your routine that may have triggered this response? What are the body signs you feel before you have this response? Did you feel hot? Did you see red? Research the terms used to describe strong emotional responses to see if any of them describe your feelings before a strong emotional response. If your child is unable to communicate or is nonverbal, make a note of what happened before the emotional response. As your child gets older, his or her response to life may change, so understanding why a response happened will take time. When coping with stress, is there avoidance? Does your child avoid a stressful event or task? Avoidance can be simply refusing to engage. It could be walking away or procrastination. If so, what are the signs of avoidance and what events triggered this response? The biggest thing to remember about stress management for people with autism is that these emotional traits can be seen in many people. Certain things can bring on a more extreme response, such as fatigue, feeling overwhelmed, other body signs such as hunger or pain, not understanding instructions, not having the ability to ask for help, fearing rejection and social isolation. There is no shame in stress responses. Understanding how to effectively manage stress for your autistic teen or young adult will help to reduce mental health problems and empower your child with the skills to work, make friends, build relationships, and deal with daily life. So, in this video, we just touched on the tip of the iceberg of stress management for teens and young adults on the spectrum. In later videos, we'll talk about how to learn long term strategies for regulating stress responses and some short term fixes for dealing with stress in the moment. So, thank you for watching this video. If you like this information and want more resources, check out our website and subscribe to our channel. Thanks for watching.